morning. Liberty Vittert here, host of MIT's data science podcast, Data Nation. So much of what we are told about COVID revolves around data. Are we now at the time where scientists have said, okay, we're going to take a step back here, examine the risks of COVID to healthy young Americans and the risks of the vaccines?
That would be the smart thing to do, but that is clearly not where we are because the CDC has recommended that everyone get these vaccine boosters who are over the age of 6 months old. We are living in a crazy time, at a time where people are healthy enough and COVID is low enough that we should be taking a step back and looking at the data, but we're not. We are not looking at the safety and efficacy of these vaccine boosters like we should be. We don't know if they're safe or not. We don't have data on it. Pfizer only did this on mice. They haven't even done it on people, the trials for this booster. So we just don't know. And in terms of efficacy, the vaccine is supposed to prevent hospitalizations and severe illness. If you are young and healthy and you have been vaccinated, you are not going to the hospital when you get COVID. So there's no point in taking a vaccine booster.
You obviously live in the scientific community. You teach at a number of these universities. Help us understand what is happening in the scientific community that of all the things that the scientists say we must study and that we're going to have thought about and hypothesis and challenges to, why COVID is still off limits?
Somehow the COVID vaccine zealots have basically hijacked this entire vaccine discussion, lowering the public's trust in science beyond anything we've ever seen. Pre-pandemic, only 13% of the American public felt that they didn't have trust in scientific community to do the right decisions for the American public. Now we have over 50% of the American public who don't trust scientific institutions to do the right thing for us. That is a real problem, not just with the COVID vaccine, but with all vaccines. We're seeing lower rates of polio vaccinations, MMR vaccinations that we need to keep America safe from another type of pandemic.
Is there any V8 moment, an aha moment within the scientific community? Is there any sort of self-awareness of what's happening and the dangers that you just laid out?
Well, you see it in Florida. They're pausing this. They're saying we only recommend it for people who are over the age of 65. But it's only America where this is happening. The UK is only recommending it for people over the age of 65 and people who are at severe risk for illness. I mean, something is happening in America with the scientific community where we have allowed these COVID vaccine zealots to just take over.
Interesting. So when you talk to scientists overseas, when you go to these studies and conferences all over the world, what do they say?
They are not recommending what the United States CDC is recommending.
Do they look at what's happening to science in America and kind of look at you guys and be like, huh?
People aren't allowed to question it because all of a sudden, no matter who you are, whether you're a scientist abroad or you're a scientist here, you are somehow a bad person if you say you shouldn't get this COVID vaccine booster. Huh? It's a really dangerous world that we're living in for the scientific community and the American public in general.
Well, and a lot of doctors will tell you, not necessarily brave enough to do so on TV, that they're worried about what happens when the next pandemic comes, because if you don't have trust and then something really bad comes along, what do we do? All right, Liberty, thank you very much.
Thank you.
Thanks for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to subscribe. Click the red button to get more of News Nation's fact-driven, unbiased coverage.